Practice question 21. A nurse is assessing a patient who has been experiencing diarrhea for 3 days. Which of the following is the nurse's priority? A. Encourage the patient to eat a high-fiber diet. B. Monitor the patient's electrolyte levels. C. Administer an antidiarrheal medication. D. Measure the patient's daily weight. Correct answer. B. Monitor the patient's electrolyte levels. Rationale. Prolonged diarrhea can lead to significant electrolyte imbalances, which can be life-threatening. Monitoring electrolytes is a priority. High-fiber diets and antidiarrheal medications may be considered later, and daily weights help assess fluid status, but are not as immediate a priority as electrolyte monitoring. Practice question 22. A nurse is preparing to administer an intramuscular injection to an adult patient. Which of the following sites is most appropriate? A. Deltoid muscle. B. Dorsogluteal site. C. Vastus lateralis muscle. D. Abdomen. Correct answer. A. Deltoid muscle. Rationale. The deltoid muscle is commonly used for intramuscular injections in adults, especially for small volumes of medication. The dorsogluteal site is less favored due to the risk of damaging the sciatic nerve. The vastus lateralis is used for larger volumes or in children, and the abdomen is not typically used for intramuscular injections. Practice question 23. Which of the following findings would indicate that a patient is at risk for impaired skin integrity? A. BMI of 22. B. Moist, warm skin. C. Impaired mobility. D. Intact sensation. Correct answer. C. Impaired mobility. Rationale. Impaired mobility increases the risk of pressure ulcers and skin breakdown because the patient may not be able to reposition themselves to relieve pressure. A BMI of 22, moist and warm skin, and intact sensation do not by themselves indicate a risk for impaired skin integrity. Practice question 24. A nurse is caring for a patient with a nasogastric NG tube. Which of the following actions is essential to ensure proper functioning of the NG tube? A. Flush the tube with saline every 4 hours. B. Measure the external length of the tube. C. Keep the head of the bed flat. D. Provide oral care every shift. Correct answer. A. Flush the tube with saline every 4 hours. Rationale. Flushing the NG tube with saline helps to maintain patency and prevent blockages. Measuring the external length can confirm that the tube hasn't shifted, and oral care is important for comfort, but does not ensure the tube's proper function. The head of the bed should be elevated to reduce the risk of aspiration. Practice question 25. A patient is scheduled for surgery and expresses fear about the procedure. What is the most appropriate response by the nurse? A. There's nothing to worry about. The surgery will go smoothly. B. Can you tell me more about what you're feeling? C. You should focus on the positive outcomes of the surgery. D. It's normal to feel this way before surgery. Correct answer. B. Can you tell me more about what you're feeling? Rationale. Asking the patient to share their feelings allows the nurse to understand and address specific concerns. This therapeutic communication technique helps the patient feel supported and validated. Simply reassuring or dismissing their feelings does not address their anxiety effectively. Practice question 26. A nurse is educating a patient with osteoporosis about ways to prevent fractures. Which of the following recommendations is most appropriate? A. Engage in high-impact exercises like running. B. Take calcium and vitamin D supplements as prescribed. C. Increase your intake of caffeinated beverages. D. Limit weight-bearing activities. Correct answer. B. Take calcium and vitamin D supplements as prescribed. Rationale. Calcium and vitamin D are crucial for bone health, and taking supplements as prescribed can help strengthen bones and prevent fractures. High-impact exercises and excessive caffeine intake can increase the risk of fractures, while weight-bearing activities should be encouraged to maintain bone density. Practice question 27. A patient with a history of chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy. The nurse should monitor for which of the following complications? A. Hypoxemia. B. Hypercapnia. C. Hypokalemia. D. Hypernatremia. Correct answer. B. Hypercapnia. Rationale: in patients with COPD, excessive oxygen administration can suppress the respiratory drive, leading to hypercapnia, elevated carbon dioxide levels. Monitoring for signs of hypercapnia, such as confusion or lethargy, is important. Hypoxemia, hypokalemia, and hypernatremia are not directly related to oxygen therapy in COPD patients. Practice question 28. A nurse is caring for a patient who is receiving a blood transfusion. The patient reports chills and back pain. What is the nurse's priority action? A. Slow the transfusion rate. B. Reassure the patient that this is a common reaction. C. Stop the transfusion immediately. D. Administer an antihistamine. Correct answer: C. Stop the transfusion immediately. Rationale: chills and back pain during a blood transfusion may indicate a transfusion reaction, which can be life-threatening. The nurse's priority is to stop the transfusion immediately to prevent further complications. The healthcare provider should be notified and appropriate interventions should be initiated. Practice question 29. A patient with rheumatoid arthritis is prescribed methotrexate. Which of the following instructions should the nurse include in the patient's teaching? A. You can drink alcohol in moderation while on this medication. B. Increase your intake of folic acid-rich foods. C. Take this medication on an empty stomach. D. This medication is safe to use during pregnancy. Correct answer: B. Increase your intake of folic acid-rich foods. Rationale: methotrexate can lead to folic acid deficiency, so patients are often advised to increase their intake of folic acid. Alcohol should be avoided as it increases the risk of liver toxicity, and the medication is not safe during pregnancy. It is typically taken with food to reduce gastrointestinal side effects. Practice question 30. A nurse is providing postoperative care to a patient who has undergone abdominal surgery. Which of the following interventions should the nurse prioritize? A. Encourage the patient to take shallow breaths to avoid pain. B. Limit the patient's fluid intake to prevent edema. C. Encourage the patient to use an incentive spirometer. D. Ambulate the patient as little as possible to prevent stress on the incision. Correct answer: C. Encourage the patient to use an incentive spirometer. Rationale: using an incentive spirometer helps prevent postoperative complications such as atelectasis and pneumonia by encouraging deep breathing and lung expansion. Shallow breathing, limited fluid intake, and restricting ambulation can contribute to complications and are not recommended.